good afternoon, good evening, depending on which part of the world you joined us from. You're welcome to Raphael Medical Center's pre-Vows Day event. Yes, you can see I'm buzzing because the much awaited day is here and the time is now. We're sorry for the late start, but trust me, your time will definitely worth it. This is the time you share the link. Make sure you share the link to your respective WhatsApp groups or your friend. Don't let them miss out on this all-important conversation. My name is Kofi Annan, your host for this morning, and I'll be joined in studio by our speakers. And talking of speakers, well, I have two great ones for you. Magnificent in their respective fields, top-notch personalities. I know you would love them. To join me have this all-important conversation is clinical psychologist Mrs. Charity Kuwornu and Raphael Medical Center's medical director Dr. Michael Kwashie. This show is going to be a very interactive one, so make sure you connect with us on all our social media handles: Facebook, Instagram, Twitter, now X. Since I was a Twitter than X, so if I say X, you know what I'm talking about. With time, we would also announce the phone lines, so at the point of the conversation, if you have any question, if you have any interaction, contribution, you can always share them. Just note that we are streaming live on Facebook, live on YouTube at Raphael Medical Center. We go for a short breather, and when we are back, we go right into action. The conversation on sex education and sexual dysfunction starts right here. My name is Kofi Annan once again. We go for the breather. We are back after this. Welcome from the short breather. Just in case you just joined us, this is Raphael Medical Center's pre-Vows Day event with the theme Building Healthier Relationships. But just note that the focus is on sex education and sexual dysfunction. I've been joined in studio by our two great speakers, and without wasting much time, I'll just go to Studio B and engage them. On my immediate left is a clinical psychologist, Mrs. Charity Kuwornu. Thank you for joining us, madam.
Thank you, Kofi.
I hope you are doing well.
Grace.
And you are CEO for the Trinity Wellness,
Delight
Wellness and Counseling School. How's the school doing?
By the grace of God.
What does the school do? Do you train counselors? Can you let
Yes.
us know what
We train counselors and they become accredited lay counselors
Okay.
and accredited to Ghana Psychological Council. It's a professional training.
That's great. So you heard that. Just in case you want any sort of training for counseling, Delight Wellness and Counseling School, they got you covered. Dr. Michael Kwashie, you're welcome.
Thank you.
I hope you're doing well.
I'm doing great.
That's great. I mean, our viewers have been waiting for this particular day, especially because of our focus, sex education and sexual dysfunction. There have been several questions around this theme, so I trust that we will do justice today. But my first question will go to you, Madam Charity. I just want to ask, how does sex education helps in building a healthy relationship?
Oh, thank you, Kofi. As we all know, sex is a taboo in our parts of the world, especially in Africa. We hardly talk about sex, and sometimes sex is seen as something that we don't have to talk about. But it's very key we speak on sex. It's an information that is passed on to all other persons, ranging from any age group. When the person becomes curious and starts asking certain questions, as early as age 2, you could educate your child on
As
sex.
early as age 2?
Yes,
Okay.
when your child starts asking you, Mommy, what is this?
Okay.
Daddy, what is this?
Okay.
The child
That's
is.
where the sex education
Yes,
starts.
yes. So it's an information and it's based on facts of the matter. You talk to the child about everything to do with sexual reproductive organs. You talk to the child about, or any other person about, what pros and cons, the consequences of sexual life choices, and then you try and make informed choices based on what you think would be right for you. So it's basically speaking about sex.
Okay. And how will that knowledge help one in building their relationship?
Okay, so in building, so far as you have knowledge, you have power.
Sure.
So once you have been educated, you know what it is, what the meaning of each organ is and its function, and especially with my part, the function of the cognition, the brains, the mentality around it, your emotions, how you guard against certain odds and how you manage yourself and certain behaviors that in quotes could be accepted, then it means that you're on a journey for a great relationship. So you could know where you have lapses, where you have to improve, what you have to do to build the emotional love line between you and your partner is great. So that's the essence of sex education, in making relationships thrive, healthy and long lasting.
Great. So far, I understand what you said. You knowing yourself,
Yeah.
you having that sexual education at that early age will definitely go a long way to help you building your relationship.
Yes.
I'll come back to you, Madam Charity. Doc, I just want to ask, Madam just spoke about sex education. I just want to know how the lack of sex education can affect one's sexual function.
Thank you, Kofi. So sex education, as well articulated by my co-panelist, is crucial to having a very good and healthy sexual life. And there are a number of things that could happen or occur if there's lack of sex education. For instance, when engaging in sexual practices, so sex education will throw light on contraception, will throw light on safer sex practices, prevention of STIs and HIV, for instance, and also the prevention of unintended pregnancies. So lack of sexual education could result in any of this happening. There could also be issues of performance anxiety, where people are anxious about their performance when it comes to sex, and sexual education could allay some of these fears. Also, misconceptions, misinformation could be taken care of when there is adequate sexual education. Also, people who have self-esteem and confidence when it comes to sex and their bodies, and so the lack of sex education can actually be detrimental to the sexual health of an individual.
Because you mentioned anxiety, I want to ask Charity Kuwornu, what are some of the stresses of life that could actually affect one's sexual function?
Thank you. So we have to understand that anxiety comes from a certain space.
Okay.
It comes from your mental health or your psychological function. And also sometimes as a result of stress of life, you could also be hit by anxiety. Whenever we talk about psychological, then it has to do with your cognition, your mental strength, your resilience, and how you are able to manage yourself through tough times. Stress, as we know, we are hit by it every day in our lives. But if the stress overcomes you physically and then mentally to the extent that you get weak and you are not able to hit or meet that demand, then it becomes a negative stress on you. And of course, anxiety is a vital reaction to any threat. So when you are faced with stress, anxiety, or depression, one fact is that people may always think it's always negative when it has to do with relations.
Okay.
But it's not always so.
Okay. There's a positive.
Yes,
okay,
it could be there could be some positivity to it. People can be stressed and decide rather to get closer to their loved ones. I'm stressed, but I feel like getting closer to my husband, my wife, for us to talk, for us to deliberate on the issue.
The way to distress.
Yes, to distress me. So whilst we are talking and lamenting, and we are getting closer with our emotions, it will spark off. And before you realize, the physical intimacy then into something else. And you can have a great sex in the stress. Yes. Then also, sometimes because you will lack something, there's something you lack. And that's why you are going through the stress. That's why you are lamenting. And you need something to replace. So some people will choose to have a great sex time with their spouses or their wives, husbands. And whilst they engage in doing so, in order to get something to compensate for the loss, sexual activity can be very high. Then also, when people are stressed or get going through distractions of life, they see it that they are so much outside of their problem. So to get inside, why don't I rather increase my sex life and have fun to help me serve as a distractor against the problem I'm going through? In this way, sex can be great whilst you are going through issues of life. But the other side of it, the psychological side of it, sex drive can drop actually when you are going through stresses of life. The drop is because you are consumed with worry. You are troubled. You can't sleep. You are crying. Something is not being understandable in your life. With that, where is the taste? The feeling is gone. Everything is almost dead in you. Your wife touches you and you are like a stick. You are numb. Oh, excuse my language. You are not responsive because you are overwhelmed with life challenges. Sometimes too, the busy brain, you know, you are going through stresses and the brain is just moving around, looking at where you can get escapes. So in so doing, through the busy brain, where is the space for intimacy? Where is the space for love making? So when it is like that, then the role of sex can drop and your arousal, feelings, desire can also go aback. The last is that when stress stays on a person for a long time, they term it chronic stress. With chronicity of stress, it affects the sympathetic nervous system. And it is this sympathetic nervous system, I'm sure doctor will talk about it, that is what pushes us into great sex. That pushes the organs into releasing the hormones to put you into a relaxing nature, a lovely nature. But when the sympathetic nervous system is affected, then blood pressure goes high and other vitals of the person moves high. When it is like that, your arousal goes low, blood supply to the genitals become weakened, the penis will refuse to erect, you will touch your woman and everything is flat. When it is like this, sex can be impeded. So in all, we will say that sexual function can be affected positively or negatively depending on who you are, the choices you make, and how best you can make out of the sex life.
So the stresses of life can impact us positively or negatively.
Sure.
Look, I want to come to you on this because we are talking about the stresses of life and the possibility of you having a good sex whilst you are stressed. I want us to talk about the sexual response cycle. What do we mean by sexual response cycle? So that we can find out whether if one is stressed, the person can actually go through the cycle.
All right, so the sexual response cycle basically is a series of events, psychological and physical, and also emotional, that an individual goes through when they are sexually stimulated. And it could be, there are various models of the sexual response cycle, but one common model looks at 4 phases, where there is the excitation phase or the excitement phase, and then there is the plateau phase, the orgasm phase, and then the resolution phase. So those are the various phases of the sexual response cycle.
Excitement,
yes.
Plateau, orgasm, and resolution.
Yes.
So,
yeah, so those are the various phases, the 4 phases of the sexual response cycle. So the excitement phase usually could last for minutes to hours, and
the excitement phase
could last for minutes to hours. Yes, and here you have a lot of increased blood flow to the genitalia or the genital organs. There's increase in heart rate or pulse, and also the blood pressure will go up. Then we move to the plateau phase, where the symptoms or the signs that you see in the excitement phase are accentuated. So the blood pressures, the heart rates will increase, the blood flow to the sexual organs will be much more.
Sorry to cut you. Is this still within the minutes to hours?
So the plateau phase is a bit shorter. So this one is than the so that's about just minutes, seconds to minutes.
Okay, like some 2 minutes.
Then we move from the plateau phase to the orgasm phase, which is the climax, and here it lasts for just seconds.
Wait, the orgasm phase lasts for
seconds.
Seconds.
Yes, seconds.
Okay, correct.
And then another orgasm phase. Then you have the peak of all the events. So the heart rate is at its peak. The respiratory rate is at its peak, the pressure is at its peak, and the blood flow to the organs at its peak. After the orgasm phase, then we go into the resolution phase, where all the sexual organs are coming back to their non-excitatory state. So they are coming back to their usual state. So blood flow reduces and returns back to normal, and all other sensations return back to normal. So that's basically the sexual response cycle.
Okay, but so based on this, let me ask you, how long should sex last for someone to go through all this, sexual response cycle? How long should sex last for someone to actually go through this?
So the excitement phase, because it can last for minutes to hours, it will actually start even before the main bedroom event. Okay, so that is why it will last for minutes to hours.
Okay, the excitement phase.
Yes.
I understand you could start even before.
Yes.
So probably your spouse testing you.
Yes,
preparing your mind.
yes. So that could be
Okay,
the excitement phase. But there isn't an exact timing that we can say that, okay, sex should last for 1 minute or 5 minutes. It all basically depends on how long it takes you to get satisfied or get to the orgasm phase and then go through the resolution phase. So someone may have 5 minutes of sex and be well satisfied. Another person may have 20 minutes and be well satisfied.
Okay. I'm asking this because there's been a lot of questions around how long a man should last, how long it should take, and all that. That's why I'm asking this. I'll come to you on that. But Madam Charity, I want to ask about sexual fulfillment. I want to know some of the things that informs sexual fulfillment. So you can take time and then answer that question. In case you just joined us, this is Raphael Medical Center's pre-Vows Day event with the theme Building Healthier Relationships. Our focus is on sex education and sexual dysfunction. Like I said, this is a very interactive program. So if you have any questions, any contributions, you can connect with us on Facebook, Instagram, Twitter, now X. I'll surely pick up the questions, read them out, and our speakers will do justice to it. Also, you can reach us on 0501 255 830. That's 0501 255 830. You can send your questions via SMS, and at a point we'll open the phone lines so you can phone in and ask your questions. We thank you for joining us. Just know that this show is made possible by the management of Raphael Medical Center and then also our respective wellness packages. Just know that we have the premarital wellness package just in case you and your partner you are planning to do the settlement. You need to come and run these labs. If you have an aged person, being it your dad, your mom, we have a comprehensive men wellness package and then a comprehensive women wellness package for the aged. You can always walk through Raphael Medical Center and then our wellness package will serve you well. Madam Charity, so I want us to look at some of the things that informs sexual fulfillment.
Yes, so thanks, Kofi. So when we talk about sexual fulfillment, there are certain ingredients. Like we want to prepare soup, meko kakra, tomatoes kakra. You put in certain things to make it tasty.
Okay.
So it's not like you just jump on the woman and then you jump on your husband and that's it. But there are certain ingredients we need to push in to help. One key thing is communication.
Okay.
Yeah, we need to build on communication when it has to do with sexuality. I'm talking about sex and communication, to be precise. So please try and accept one another and also comfort one another. Know that the experiences of sexual arousal can be linked strongly to communication. It is through communication that your wife will know that this evening something will happen in the bedroom. Maybe you have a style of saying it, maybe just a whistle. It means that this evening it will happen. Yes. Or a call, or a text message, or a small note under the pillow. All these things should speak. Or even sometimes in the morning, a special hug could speak to it. Or maybe touching your wife behind from the back could say that today something will happen. So let's find ways of communicating, love making in the bedroom, exclusive to the two of us. And then also, you need to communicate your needs. You have to be open and honest. I have a friend who's the organ that really excites her when it has to do with sexuality or sex life with her husband is at her knee. So they don't touch her knee. If you are laughing with her, you hit her knee, she'll be angry with you because her knee is very sensitive. But how will a husband know that your sensitivity is right there in your knee? Well, everybody is thinking about maybe the erroneous places, the breast, the buttocks, and those, yes. But here she is, her own is on her knee. So be open and honest. My husband, this is where my feelings are. Tell her, tell him, tell her, inform her. I want comfort. Please, when you touch this place, I love it. Communicate to him or her. And then also, be clear on your communication. Don't do as if, oh, I like it, as if I don't like it. I mean, be clear and tell him, oh, this thing, this is what I like. These are my boundaries. These are my preferences. I would want you to bath me in the morning. That evening, if we have to make it, please send me to the washroom, bath me, deodorant me. I would want to put you at my back. You know, all these things, they spice up love. And also communicate about your desires. I wish you kiss me through maybe my ears, the love making. I want you to fondle me as a woman. Because I'm a lady, I'll speak more to us. I want you to handle me as a woman. As a man, I want you to make me feel these things to your husband or your spouse. And then also, if the husband is touching a place and you like it, you could make certain sounds. Oh, move on. Make it softer. Make it harder. I love this place that you touched. I mean, we shouldn't be too stiff in the bed.
Sure.
Open up. And sometimes it's only one that the man will hit. But explore the 8, the clitoral orgasms, the cervical orgasms, the various points. The doc knows them. You should be able to navigate all these 8 places for your woman. You need to do press-ups and work on your waist so that you can be able to thrive well and move through well. So these desires are all something that you need to communicate. You need to communicate with your eyes. Your eyes should speak love. Your mouth should speak love with kisses. Your words should be soft when it comes to the bedroom setting. And then also you should be able to use the words efficiently. And then also you need to communicate certain non-verbal speeches or behaviors. You know, your fragrance, men pasting, women pasting, putting beads. Yes, putting your beads at your back as an African lady. Yes, and then spicing, wearing some 90s that will speak. And then also, you need to be positive when you are speaking. In fact, we don't want the bedroom that you are now coming to talk about. Last year, issue that happened, and then some monies you are supposed to give to me, you didn't give to me, you frowned in the bedroom, you are not friendly, and you are talking too much. That will not also help. And also you need to know that there's a golden rule for accommodation. Be supportive, be patient. And you know, men move with ego. So when your husband is doing well and he's thrashing you well, and you should congratulate him. Brother, today I really enjoyed you. Bonabaso. You are my king, you are my man, and make him feel good. You see, even if he has a challenge, manage him. Sex is not always inter. It could be outer course too. So if he has any issues, you can help him with this outer course. You have to be positive about your communication. Ask questions. You know, if something didn't come out well, clearly, please ask questions. Please, what did you say? I wasn't clear on this, so that your husband, your wife will be able to explain things to you. And then also, you should also talk about intimacy emotional intimacy, looking directly into the eyes and, sharing the love, passionate kisses, great romance. All these things will spice up the marriage. And also, women and men, we need to be respectful to one another. We need to keep the house clean. We need to keep the bedroom clean. We need to put in certain things to help with the sex drive so that everything in the home will be explicit and good.
That's great. So to our ladies out there, you heard the Bonabaso bit. I mean, if your husband is doing well, Bonabaso, your partner is doing well, Bonabaso, to encourage them. But Madam Charity, I want to ask you, so how do you deal with a partner who's not forthcoming? Some people shy away from talking about sex, even how they want it. So I know for a fact, research has proven that there are several women in relationships, marriages, that has never had orgasm. And it's simply because they are not forthcoming with what they want. How do you deal with such a partner?
Yes, so these things has to do a lot with our roots, how we are brought up. Sex is a taboo we hardly speak about. So if we don't do programs like this to educate people and empower us so that we'll be able to come out and talk, people will keep quiet and silently they'll be suffering. So please, it depends on the person's temperament. Okay. There are certain temperaments, they are not open. For example, the phlegmatics, hardly would they come to you to make love, but they are great in bed. If you are married to a sanguine, evening time, every time, they are always hot. Sure. Yeah. If you are married to a phlegmatic, it's very sensitive. Any little thing he can pull out. So you should know, and then the cholerics are hard. So you should know the temperament of your husband, your wife. That can also inform. But in all, one should be able to make the approaches. Sometimes you are married to a man who will not come closer. A man who is just there, he is unromantic. But the ladies must be empowered. Your husband loves sex, but he's just unresponsive. Get closer. We should stop that adage that it's only the man that should come. Women, please get closer. Go and sit on your husband. Caress him and see whether he will say no. Of course, unless the man is going through some stresses. Otherwise, every man that is your husband, you get closer, he will definitely respond. And also, we should make sex lovely. We should prepare ourselves from morning to evening. We shouldn't just make it a 5 minutes episode or 1 hour and we are done. The whole day must be about it. Put your husband's pictures under your bed, under your pillow, on your phones, everywhere. Explore him. Put your wife's picture in your car. Even you can put it on your steer. When you are driving, you look at her. Admire your wife, test her, give her flowers, give her gifts. Know her love language. She's cooking, you are there with her. She's washing clothes, you are there with her. You share with her with household duties. You are there with her with touch and gifts. These things will spice up love. So we shouldn't say that your husband or your wife is not being responsive, so you also decide to sit back. Put in every effort and catch him because he's yours. And exchange your heart with him. Talk to him and love him. It will work for us.
And if possible, they can seek counseling. Right?
Of course.
Madam Charity mentioned that there are times people get to the bedroom and that's where they want to discuss things from last year, the issues they've had. And we both know that in situations like this, it might be to the fact that they might be suffering with some sexual dysfunctions. So I want us to look at some of the common medical conditions that can affect one's sexual health.
All right, thank you very much, Kofi. So sexual dysfunction, you could look at it in the perspective of the females and also from the men's side. All right, so looking at the female side, there are different types or classes of sexual dysfunctions. So we could have what we call the female orgasmic dysfunction or disorder. We could have the female interest arousal disorder. We could also have female genitopelvic anal penetration disorders. For the male side, mainly we'll talk about erectile dysfunctions and also ejaculatory disorders. So for the ejaculatory disorders, which I'm sure a lot of people will be interested in,
Sure.
we could have.
Is this same as premature ejaculation?
So ejaculatory disorders is a broader umbrella
Okay,
under
so that
which
falls under.
premature
Okay.
ejaculations will fall. So another ejaculatory disorders we could have what we call unsatisfactory timing.
Unsatisfactory timing.
Yes,
Okay.
of ejaculation.
Okay.
And so we can look at premature ejaculation or delayed ejaculation. Then we could also have unsatisfactory sensations, where we look at painful ejaculations or anorgasmia or ejaculation anhedonia, where there's no pleasure. Then we could have what we call absent ejaculate. So there's no ejaculatory fluid. And that could also be because of retrograde ejaculation or anejaculation.
Okay.
Then the final one is where we have hemospermia, or where there's blood in the semen. So these are different types of ejaculations, but the commonest of this is the premature ejaculation, where generally people ejaculate quicker than they would want. That's a general understanding of premature ejaculation. So both partners or one partner is not satisfied with the early ejaculation. And we have two main types, the lifelong and acquired. Lifelong meaning that it started once the person became sexually active and is with the person throughout life. So that is lifelong.
Sure.
And technically, we say that the person ejaculates within a minute of vaginal penetration. Within 1 minute of vaginal penetration, the person ejaculates. That's a lifelong premature ejaculation. It could be mild, where people ejaculate within 30 seconds to 1 minute. It could be moderate, where they ejaculate between 15 seconds to 30 seconds.
15 seconds to 30 seconds.
Yes,
God.
and they ejaculate. And it could also be severe, where ejaculation is less than 15 seconds.
Less than 15.
Sometimes they even ejaculate before vaginal penetration. So those are the severities of premature ejaculation. And the acquired one is someone who normally has normal ejaculation, but all of a sudden starts having ejaculation latency reduced to about 3 minutes or less. So that is acquired. So the person started well, ejaculation was normal, but along the line, the ejaculation period has reduced to less than 3 minutes. So we say that one is acquired. So those are the different types of premature ejaculation.
Okay.
Yeah.
I just want you to talk about the delayed ejaculation.
All right.
I just want to know how that also works.
So delayed ejaculation, this one usually there's market delay, either market delay or infrequent delay or absent ejaculation.
Absent ejaculation.
Yes, and usually happens about 75 to 100% of the time during sex, and causes distress to the individuals involved, and also usually lasts for about 6 months. So when these ingredients are present, then we say that the person has retarded or delayed ejaculation.
Okay. Okay. So we will come to some of the lifestyle stuff people need to do to help themselves, and then we'll come to the medical bits. But I want us to talk about the hormonal levels in sexual dysfunction and how they can be balanced or regulated.
All right, so these sexual dysfunctions have various causes. It could be endocrine, as you mentioned, hormonal levels, where various hormones are necessary for the sexual response. So, for instance, in females, we need a good amount of dopamine for desire. You need epinephrine, norepinephrine, and serotonin for arousal and orgasm. So any imbalance in these hormones could affect the sexual response. Again, in the males, you need testosterone for good sexual function. So if there is reduced levels of testosterone, for instance, we could have issues with the sexual response. Also, for instance, thyroid disorders can also affect sexual response in both males and females. High levels of prolactin can also affect sexual function in both males and females. So, yes, we need a very good fine balance of hormones, various types of hormones, in order to have very good sexual response. There are other medical conditions that can also affect sexual response. For instance, we have vasculogenic conditions like hypertension, peripheral vascular diseases, coronary artery disease could affect sexual response. We could have neurogenic, because you need both nerves and blood vessels to have very good sexual function. So diseases that can affect the nervous system, like strokes, Parkinson's disease, spinal cord injuries, peripheral neuropathies from diabetes, could all affect the sexual response, either in males or in females.
So we spoke about the male sexual dysfunction and types. Can we talk about the female sexual dysfunctions and types?
Yeah, so the female sexual dysfunctions and types. So we have what we call female sexual orgasmic disorder.
Female sexual
orgasmic disorder.
disorder.
Yes, where they also tend to have very delayed orgasms.
Okay.
Then or no orgasms at all. So some people throughout their sexual life have never experienced an orgasm. So it's a disorder. Then we have what we call a female sexual interest or arousal disorder, where they don't have any interest at all in sexual activities. So very low libido levels, no interest at all in sexual activities. Then we have what we call the female genitopelvic pain or penetration disorders, where there is pain, either insertional pain or deep pain on sexual intercourse. So those are the three main categories of female sexual disorders: the orgasmic disorder, genitopelvic pain penetration disorder, or the female sexual interest arousal disorder.
Okay, so what are some of the lifestyle changes one can make for both female and female to actually help us with sexual disorders?
All right, so lifestyle modifications. They are very basic. Exercise is one.
Okay.
Exercise is known to improve sexual health. Then avoidance of alcohol, cessation of smoking are some of the things that can also help. The use of substance abuse is something that affects sexual health. So you want to avoid the abuse of substances. Some medications affect sexual health, and so once you are on a medication that's affecting your sexual health, you may want to also see your physician to adjust the dosage or change the medication for you in order to have a healthy and a fulfilling sexual health. So those are some of the lifestyle modifications that can affect sexual health.
Madam Charity, as part of the female disorders, Doc spoke about no interest. I just want to ask how trauma, both past and present, can affect one's sexual health and relationships, and what are some of the effective therapeutic approaches for addressing trauma-related issues. But in the meantime, our social media handles are always available. You can send your questions if you have any. Raphael Medical Center on Facebook, Instagram, Twitter, and the phone numbers are right here: 0501-255-830. That's 0501-255-830. If you join the conversation, you have any question, you have any contributions, our speakers are here. You can send them. I'll read it out to them, and surely they will do justice to it. Madam Charity, let's look at how people trauma from the past. Because I'm suspecting someone who has no interest at all. It could be from trauma from the past. So let's look at how trauma and all that affects us.
Thank you, Kofi. So, Dr. Kwashie, I love your submission.
Sure.
All that. So to explain a little bit about trauma, trauma is something that is not pleasant. I mean, to be traumatized can really go a long way to affect your sexual life, where it can kill your interest. Let's look at how trauma can affect your physical health or physical impact. When there is trauma, for example, rape, or a husband that will not have patience with you, or a wife that is nagging, disappointing, insulting, a husband that will not even abuse you emotionally, it can affect your physical health. Physically, if a girl or a young lady has been raped earlier, there could be tension in the vaginal orifice. When the system is so choked and the person is going through pain, there can be great lubrication, and you need lubrication for great sex. But when the whole place is dried up, it will end up with pain. So there could be pain there. Sometimes the muscles are thrown into spasms, like vaginismus, where the muscles can even be thrown into spasms and cause great pain. And the woman will definitely feel nothing better in the sex. Sometimes there could be tissue damage. If you don't manage your woman well, you don't romance her well, and you just enter, you cause damage to the tissues around. And these things can cause sores, and it will make the woman happy with the sex, and it's traumatic. Then also emotional impact. People have gone through a lot of emotional, negative emotions. There are some people, they are even afraid of the bedroom setting because of, their dads, their uncles, incest, and what have you. So once they see a bed, they see an erected penis, they are dying. So these things, fear, anxiety of the future, feeling guilty in the bedroom, shame, anger, all these things can be very traumatic in the bedroom. So these emotions will definitely affect sexual desire. Your desire for the whole thing, which should be beautiful, will go dry. And then arousal, where the man's feelings will start rising up. You see the penile erections and those things, the woman becoming softer and being enjoyed. You see it going out and there's no pleasure in what is happening. The emotional intimacy between a man and a woman must be great. You can't handle your wife as if your wife is not human. Your husband, you handle her anyhow, him anyhow, talk to him anyhow, talk to your wife anyhow. You are not responsive to the chop money that she's supposed to have. You don't pay the children's fees. You are not caring, and you expect the woman to respond to you sexually. It will be difficult. These are some of these experiences in life. And of course, some people also have developmental issues in their upbringing, emotional neglects that they have suffered in the hands of people they lived with. And sometimes developmental issues, that's Doc said, certain things didn't develop well. All these things can affect the intimacy. Distrust. When you know that on your phone, you've saved the person's name mechanic, but you meet her somewhere under a certain tree. You see, when the woman sees these things, honesty and distrust, it kills the woman's spirit. So these things could be heartbreaking and can affect. Then of course, hyperarousal and then hypoarousal issue. Some people have gone through issues where their things are bent, they have lost huge things, and then the system is just on fire. These things will cause panic, fear, and then will lead to low sexual desires and interest. In fact, emotional numbness, that your man comes closer to you and you feel numb as if you are not a human and you are not responsive. All these things can affect the sexual function. Lastly, flashbacks and triggers. You are there and then you just think about a pain you experienced some 3 years back, some 2 months back. Some women are raped. In fact, studies have shown that 1 in every 5 women have experienced some kind of sexual harassment or assault. So these intrusive memories and thoughts can come even in the bedroom. They can come when the woman is almost at the time of orgasm or arousal. And all these things, people can re-experience the pain and then feel as if they are not part of the sexual life. Lastly, it's about body image. You know, people are so much concerned now about their body. To the extent that my breast is small, I want bigger. I want a chirinyam, any. So they are going in, I want, my buttocks is not too big, I want a bigger one. I've seen that I'm slouching, I've seen that my stomach is becoming bigger, and those things. And then they will run and go in for help, which is not the right way. So we want to say that, please, your self-esteem, you should feel good about yourself. I mean, you have been created in the image of God. Why don't you accept yourself? Even if you are limping, excuse me to say, you are human. It's only maybe your leg that has a challenge. So don't push yourself to any physical or emotional vulnerability. Whatever the situation is, when you seek help and you push yourself through certain things, these things will be a thing of the past and you can enjoy your sex life. Great.
Doc, I'll come back to you on how one can deal with a partner who's been traumatized because probably the person has been raped in the past. How you can deal with such a partner. I'll go to Doc and come back to you on that question. But Doc, my question is still on the female sexual dysfunction. You mentioned that some female might not even have orgasm at all, and some will have no interest at all. I want to know how you can deal with such a partner who doesn't have orgasm at all, who doesn't show interest at all. It will be difficult. How do you deal with such a partner? And are there any medical solutions to these scenarios?
All right, so every sexual dysfunction has some therapy, medical or psychotherapy, but there's some therapy. And women with female orgasmic disorders, where there's absent orgasm or delayed orgasm, also have hope. And usually we use what we call the implicit model in dealing with sexual disorders, where we allow the client or the patient to permission to voice her concerns about sex. Then you, the care provider, you provide information on the disorder that the patient is going through, then specific suggestions, concrete steps on what a person can do, and then intensify therapy, either medical therapy or psychosocial or psychological therapy. So for female orgasmic disorders, one, you want to know the cause. So you want to take a detailed history, sexual history, to know what is causing the problem. If it's, for instance, if the person is on a medication that is causing the problem. For instance, some antidepressants are known to blunt orgasm or delay orgasm. So if the person is on such a medication, or if there's some thyroid disorder, then you want, or if there's pain during sex, and so the person is unable to get orgasm, then you want to be sure what the problem is, and then once you know the problem, then you can begin to find a solution to it. So a good sexual history is important. Then a good, well-tailored physical examination is important. And once you're able to get a physical examination done, then you also, if the physical examination points to certain specific conditions, then you investigate those conditions diagnostically. And after that, you can offer the appropriate treatment. But then there's no one-size-fits-all treatment. It depends on the etiology of the orgasmic disorder.
Okay, that's great. So just in case you are tuned in and you have issues with any of the dysfunctions Doc mentioned, you can always walk into Raphael Medical Center. We are here at Tema Community 10, just around the Data Link University. We are open 24 hours, so make sure you always come in, and Dr. Kwashie will be here, and all our other doctors and specialists will be here to help you out. Doc, let's look at how one can deal with a partner who has been traumatized.
Yes, so if a partner has gone through trauma and it has really impacted the person, you need to quickly seek help. First thing is that you need either medication or psychotherapy, where the people or the specialists would work through your histories, the vulnerabilities, what contributed to what you are going through. what is maintaining it.
Okay.
And then the etiology, what are the foundations to this particular problem you are facing. And then we will take you through certain therapy sessions to help you, diffuse you, and take you through the stress of the pain and make you relaxed and receptive to good sex. Again, it's time you educate yourself with good information. Don't just pick on anything and read and consume it. But as a platform like this where the experts are speaking, you could listen, you could read, and then get information about what is informing what you are going through. And again, to be careful of this same social media, which could also lead you to a place where you rather lock yourself instead of releasing yourself. Sex education is good. Read about it and inform yourself on the facts about what good sex is. And then also there are certain practical tools you can employ about an emotional workout where you can balance your emotions with joy, with resilience, and certain practices such as sleep hygiene, sleeping better, maybe changing certain styles around the sexual activities. People should change their mindset of having sex always in the bedroom. You know, sometimes you didn't enjoy it in the bedroom, but you will be shocked
you
that
try the hall.
you can try the hall, the kitchen. Whilst you are doing, you hear the saucepans making kukuru kukuru. And it will add on to the flavor. In the bathroom, washroom, go there with your husband, bath him, let him bath you. And in so doing, you know, you are changing the context of the sexual activities. And also, we need to work at our emotions. You know, if you are going through pain or anything, please let it go. Solve your problem and don't attribute it to the sexual behavior. Then also mental health, you know, the stresses of life. We are all going through issues of life. Your moods and your self-confidence. I mean, Chale, like, man must live.
Sure.
So dress well. Even the day you don't have money, dress well, you know, eat well, drink some water, comb your hair and look good. I mean, feel good about yourself and feel confident about yourself and happy yourself. A child of God, be connected to the word of God, pray more, and reduce your stress levels. And also planning, time management, so that you'll be able to give time and room for good sex. We also want to advise on processed foods. I mean, eat the natural stuff. Okay. Ghana, we have a lot. Eat well, stop eating late, your vegetables, certain brain chemicals that Doc mentioned. They could come from bananas, oranges. You eat them appropriately. Somebody can eat 2 big watermelons. That's not how to take fruits. Okay. You can eat a bunch of bananas. Why? So we are talking about fingers, cuts, and then you manage. Yes, you manage your intakes. Then avoid sugars. You know, taking things with a lot of sugars, fetching so many sugar into your cocoa will not help. So please minimize. Go for checkups and then eat healthy. I think when you do these things and you seek for help, it will help you come out of this.
Okay. So we'll come back and talk about whether it is better to have a joint therapy with your partner if the person has, you know, if the person is traumatized. We'll come back and talk about that. And for your info, my viewers actually like the kunkuro kitchen aspect too. So they are giving you thumbs up for that. This Raphael Medical Center's pre-Vows Day event with the theme Building Healthier Relationships with focus on sex education and sexual dysfunction. My name is Kofi Annan, your host for this morning. I'm here with clinical psychologist Mrs. Charity Kuwornu and Raphael Medical Center's medical director, Dr. Michael Kwashie. We go for a short breather. When we come back, we take our social media questions, we have our phone-in segment, and then we draw the curtains. We'll be back after this. Reader, we're still live here at Raphael Medical Center. We're streaming live on YouTube at Raphael Medical Center and on Facebook at Raphael Medical Center. Do well to send your questions to to our social media handles. We'll read them out for the speakers to do justice to them. In the meantime, you can send us SMS via 0501-255-830. That's 0501-255-830. And when I announce that you can call, that's the same number you would call. So just take note of the number. That's 0501-255-830. We'll go to Madam Charity Kuwornu. Madam Charity Kuwornu, I have this question. One is asking from social media, Facebook, that is it better to have a joint therapy with your partner to address past trauma?
Okay, so it's a two-way question.
Okay.
If you are very open and honest to your partner, why not?
Okay.
You can decide to come because there's no secret in your life. So you just come and then the two of you have a session together. But if you know that there are certain things that you haven't opened up, they are exclusive to you alone, then at the sessions you can be separated. One will come, and then with the permission of one, you let my husband in, let my wife in, but please don't talk about this. Then it means you have to manage the person as a therapist, but in the end, it will boost the marriage.
Okay. But how come we share everything and then there are aspects where I come in to have a consultation with my wife and I'm supposed to excuse my wife and the doctor?
Yes. It's true, but when it has to do with privacy and confidentiality,
but amongst
the two of you, you are one, but you are two different entities. Just like HIV, the doctor cannot disclose.
Sure.
Yeah, so there are certain things that privacy and respect must be accorded.
Okay.
If the two agree that they want to come, fine. But ideally, you deal with one, you deal with the other, and then if the two agree, you match the two of them and you talk about the issue together.
Fair enough.
Yes.
So then from social media, I want you to take that question. One is asking, how do women have sex confidently after childbirth?
Great question. I think it's a general misconception that after childbirth, the female genitalia is no more the same. I think that to have sex confidently after childbirth, one, you need to have a very open communication with your partner on your fears. If there's any anxiety that you have about sex, you want to communicate that with your partner. Then secondly, you want to gradually introduce sex, starting with non-penetrative sex to eventually penetrative sex. Then in order to strengthen the pelvic floor muscles and improve vaginal tone, you want to do some pelvic exercises, Kegel exercises. So you want to seek help, get professionals who are trained in pelvic floor muscle exercises to help with the exercises, and that will go a long way in strengthening the pelvic floor and also the vaginal tone. Then you also want to explore the possibility of using lubricants if there's pain. And you think you are not lubricating enough during sex, you want to explore the possibility of using lubricants, and also some sex positions that will be comfortable for you, the woman during sex. So those are some of the things that we can do.
Sure. I'll announce my phone lines, and then I'll come back to ask you how long a woman must abstain right after childbirth. And then we'll talk about sex toys as we wrap up. So just in case you want to call in, you can call 0501-255-830 right away. Your call can come through the studio so you can ask your questions. That's 0501-255-830. You can as well send your questions via our social media handles on Facebook, Instagram, Twitter, now X. We would surely read them out, and our speakers are here. They will do justice to your question. We'll be wrapping up in no time, so if you have any questions, do well to send them in now. Doc, I was asking, how long will a woman have to stay away from sexual intercourse right after birth?
All right.
Say after delivery.
So I would not put a specific timeline to it, but the key here is that the woman must recover physically and emotionally. And so once the woman is able to recover physically and emotionally, then you can gradually introduce sex. But I will not say that 1 week or 2 weeks. If after 2 weeks the woman is not fully recovered, then you still want to wait for the woman to recover fully, physically and emotionally. So I will not put timeline on when a woman should have sex after childbirth, But the thing is that the woman should recover physically and emotionally.
Great. Okay, so it's about time we have this controversial conversation about sex toys. I want to know, there are people who believe that it's okay, it's normal to introduce sex toys in your sex life. I mean, I'm talking about couples here. It's okay to introduce sex toys in your sex life. There's this school of thought that also states that the very moment you introduce sex toys, when the man is away, the woman can be engaging the sex toy. And if the woman engages the sex toy for a long period of time, it also has an effect on her. Madam Charity, I know this is very controversial, but I just want to know, where do you stand on this? Introduction of sex toys or no sex toys introduction?
Kofi. Okay, so I have my personal stance. So I would say that ideally, it depends on the situation, but ideally, I mean, everything that the toy has is in your husband or is in your wife. So why don't you push your husband by gradually with love, patience, his hands, his head, his tongue, everything can be part of sex. So even if the organ is weak, there could be outer sex, there could be big time romance that can take place or that can replace the sex toys. Sometimes some of the sex toys can carry infections if not handled well, and then also it can not give you the desire as you want naturally. So to me, I think that the best is the human being. So I'll utilize my husband, my wife to the fullest than a sex
So
toy.
emphatically, no room for sex toys.
Yeah.
Okay, Doc. You made mention when you were talking about the female sexual dysfunctions. You made mention that there are cases where a lady could have delayed orgasm. In this case, do you think introduction of sex toys will be the best way to go about someone who has delayed orgasm?
Okay, so as part of treatment of delayed orgasm, sex toys is not necessarily a solution.
Okay.
So as I mentioned earlier, you'd want to know what the cause of the delayed orgasm is, and then you are able to adequately deal with it. So we cannot propose that sex toys, because of their nature, are able to solve someone's delayed orgasm. So sex toys, I won't say that they are a panacea to a delayed orgasm.
Okay, so you're also stating emphatically that no room for sex toys.
All right, so sex toys, if you want my personal opinion.
Sure, I want your personal opinion now, aside the medical bit. I want your
personally, I also know I will not go for sex toys. I will not go for
any
sex
reasons?
toys. Okay, so for instance, it could come with infections. People could be allergic to sex toys.
Okay.
Yes, and I think that if sexual education is carried out well, and men and women understand their anatomy and their physiology, how their bodies work, they should be able to enjoy sex without the use of sex toys.
Okay. Okay, sure. I have another question for you. One is asking, can any sex position or posture lead to stroke development, especially for the man? I would come back to you so you answer that question, Dr. Kwashie. But in the meantime, you can call in 0501 255 830. We have less than 10 minutes to wrap up. So if you are tuned in and you have any question whatsoever, aside the social media questions, you can call in right now on 0501 255 830. Doc, someone is asking about sex positions and posture. If there are any sex position or postures that can lead to stroke development, especially for the man.
All right, so coming through literature, you wouldn't find a lot of articles on sex being a cause of stroke.
Okay.
Yes, so I wouldn't say that one particular sex position or the other could lead to stroke. I will not say that. So coming to literature, no, sex is not a cause for stroke.
That's okay. We have another question here from social media. You can still call. Our phone lines are open. You can call 0501 255 830. 0501 255 830. We have another question from social media. The person is asking, are all sexually transmitted diseases imported into marriage? In other words, if a couple are faithful partners, can there still be a sexually transmitted disease? Let me take that again. Are all sexually transmitted diseases imported into marriage? In other words, if a couple are faithful partners, can there still be a sexually transmitted disease?
So that's another good question. So sexually transmitted infections are transmitted, meaning that it comes from someone who has the infection to someone who doesn't have the infection. So if you have two people, two sexual partners who are mutually faithful, and none of them is carrying a sexually transmitted infection, then you don't expect them to develop a sexually transmitted infection. So for instance, if you have two people who are mutually faithful to each other, they don't have HIV, you don't expect that HIV all of a sudden will spring up in that union, unless it's acquired through another means.
Doc, sorry to cut you. We have our caller on the line now. Hello, good morning. Your name and where you are calling from?
Hi, my name is Esther, calling from Tema. Yeah, can you hear me?
Good morning. I can barely hear you. I don't know if you can speak up, caller. I think our resource personnel in the studio are not hearing Madam Esther. The technical team would have to try again so we can get the question and then answer appropriately. In the meantime, you can still call 0501 255 830 just in case you joined us. This is Raphael Medical Center's pre-Vows Day event focused on sex education and sexual dysfunction. Just know that this show is made possible by the management of Raphael Medical Center, and it is powered by our respective wellness packages. We have the premarital wellness package, just in case you have plans to get married, you and your partner can walk in, so we run the respective labs for you at a discounted price. And then also, if you have any aged home, being it your mom, your dad, you can always come in and ask about our comprehensive men and women wellness packages. These are all subsidized packages meant to help you. We thank you for joining us. We super appreciate your time. That's why we are giving you all these packages at a discounted price. We will surely wait for our caller so we can just get the question for our resource persons to answer the question. So Doc, you were talking about that there's no chance sexually transmitted disease can just pop up from nowhere, especially when the couples know themselves. They've done all the needed tests and no one has any sexually transmitted disease. As far as they stay faithful, there's no way anyone can catch any sexually transmitted disease from nowhere.
Yes, so for instance, if you take HIV, apart from sex,
okay,
there are other modes of transmission. Okay, so if they are mutually faithful sexually, then you don't expect that HIV, which is not in the union, will be transmitted through sex.
Okay.
But if someone, for instance, gets a blood transfusion that's contaminated, for instance, in that union, then that could be a point where HIV can be introduced into that union. But through sexual means, where both are mutually faithful and they are both negative, then you don't expect that transmission to happen.
Okay, that's great. Doc, Madam Charity, let me just ask you, what are some of the common challenges faced by aging individuals in maintaining sexual health, and how can they adapt to these changes? Like we keep saying, the world keep evolving, and I mean, there are changes that we encounter at every point in our life. Yeah. So we just want to have a fair idea of these challenges based on your experience and your practice, and how we can adapt to these changes. You can still call 0501 255 830. Before we wrap up, you can as well send an SMS. You can send your question via SMS, and then we surely read it out for you.
Yeah. So aging, of course, we know, can affect a lot of things. Vital organs begin to lose their strength and power, and then sometimes the nervous system becomes goes through challenges. Blood vessels becomes thinned or becomes blocked, and sometimes the muscles become flaccid and weak. In fact, I don't know whether doc will bear me out, but I was told that even the penis, the male organ, when you are growing, it becomes smaller. It shrinks.
That's true.
Yeah. And then the vagina also becomes more drier. So you can imagine it comes with challenges. So from 50 and above, you should get ready to experience these things, erectile dysfunction and women not having their orgasm. And sometimes to life adjustments, going through retirement and then looking back. You didn't plan your life well. Now you are full of regrets. All these things can have. Yes, yes, and then you look at it and you realize that in fact you have regretted a lot of things in life. So what we have to do is that work around your emotions. I mean, it's never too late. You should appreciate that you are aging and these challenges are bound to happen. Try and then make yourself happy. I mean, exercise, eat well, and then the little that you go through, if you should have sex and you are able to do a little bit, doc was mentioning 50 seconds, maybe 1 second and you couldn't do much. I mean, appreciate your partner, should appreciate you, should encourage you, and then you can try other positions little by little, and then eat well, exercise well, and then make sex. You shouldn't make sex the priority. It could be outer sex. You could engage yourself in other ways of sexual habitations, which is all real inter. And manage yourself through. And I'm sure that when things are settled and optimum in you, age will not be the factor. You still enjoy the wife of your youth.
All right, Doc, let me take your view on this.
All right, so if you look at literature, for instance, erectile dysfunction in men less than 40 years, it's about 1 to 9%. But after 40 years, it could go as high as 30% of men having erectile dysfunction. And the peak age for sexual dysfunction in women is 51 to 59 years. So that tells us that as we age, our bodies go through some changes. For instance, the female reproductive system becomes a bit more drier.
But there's this question from social media which got me laughing, but I would have to ask anyway. Doc, someone is asking if it is okay to have sex every day. I don't know how the person is going to do that, but then we still need to answer the person anyway. Is it okay to have sex every day?
All right, so I think that there is no limitation how many times you can have sex or how often you can have sex, but your body will be able to determine that. So if you are physically healthy, both parties, both partners, you are someone who exercises regularly, that may be possible. But if not, then you want to recover after sex. So you give yourself maybe a day or two to recover before you go in for another round of sex. But if you are someone who is very physically active, very healthy, you check yourself regularly, I don't think there's any limit to whether you should have sex once a day or once every other day.
Okay, so whoever asked that question, I'm sure you have your answer. I don't know how you're going to do that. Have sex every day, even when you go to work, you take breaks. So please, just take a break. We have another question here I want to ask. One is asking, what about sex toys for women whose husbands are impotent or can't sustain an erection? Back to the sex toys conversation. Those whose husbands are impotent or can't even get an erection.
I think a lot of people are excited about the issue of sex toys. But I think that when it comes to sexual dysfunction, there are various solutions, from medical solutions all the way through to surgical solutions, where you could actually have implants, penile implants, that will help the man get an erection. So the management of sexual dysfunction is in various levels. And I think that no matter the dysfunction you have, you should be able to get a solution to it.
Okay.
Yes.
So if I get you, sex toys wouldn't be the actual
So
solution.
sex toys will
You
not be
have
the
to seek
solution
medical
in this scenario.
Okay.
It's better the couple seek medical advice, and you may never know. It could just be something very simple that even a medication could solve.
Okay.
Not even necessarily going for implant, just a medication may solve that. So
Okay.
seek medical advice, and once you seek medical advice, what the appropriate treatment is, you get it.
Okay, so don't resort to sex toys immediately. Please do well to seek medical advice first. Let's go to the question our caller Esther asked. Esther asked, in what ways do our cultural attitudes towards sex influence the availability and acceptance of sex toys here in Ghana? Still on sex toys. Let me take that again. In what ways do our cultural attitudes towards sex influence the availability and acceptance of sex toys here in Ghana?
Okay, thank you, Esther. So we just have to know that in Ghana, our culture and norms of sexual relations are something that we hardly talk about, but we can never underestimate it. We want to advise the youth that if you are not married, try and zip your trousers. We want to
Please
advise.
look into the camera and see that one.
We want to speak to the youth of Ghana that if you are not married, do well to zip your trousers and keep your panties on. I mean, katasune si. That's why they call it chain, so that you chain when it's right, then you open it up. So we want to encourage chastity and faithfulness. And of course, in our culture, we hardly talk about sex, but now it's everywhere. I mean, social media, technology, people are going global when it has to do with sex. With sex toys, all that we want to say is that we want to encourage openness and honesty about sexual behaviors. If you are going through a challenge, open up and seek appropriate help. Sometimes it's just a little stress that is bringing the sexual dysfunction. Why don't you see the psychologist, see the medical doctor to help you? If you come to Rafa, they will help you. Sometimes it will even come from an STI that is hidden somewhere. And one medication, and then you are good to go. Stop buying medicines, buying anything in the car that you are going to take, and then you end up with kidney infections, ending up at Kolebu and what have you. So we want to encourage that. Open up. Be honest about your challenge. Don't use sex toys to cover up what is actually eating you up. And then seek for appropriate help. There are so many numerous problems that can be attributed to sexuality. So go and seek for help. But the use of sex toys will cover up what is actually leading to that problem. And then it will not help. So we want to say that don't let technology and other things just push you. You just go and buy the vibrators and what have you. Seek help. And sometimes even through the help, they can advise sex toys if it's very necessary.
Okay.
But I think it shouldn't always be intercourse. Outer course is also part of sex. And in outer course, everywhere, as I mentioned, can speak to it. And it will do well.
Good.
Thank
It's
you.
still on sex toys though. And second question, how can the use of sex toys enhance intimacy between partners? That's her second question.
Of course, that will be quite difficult because it serves between you and the partner. Once it becomes secondary, connecting your husband through a sex toy is something of psychological. You either minimize your husband to the state of that sex toy, or you maximize the sex toy to the state of your husband. And that is a cognitive bias. It's quite negative to reduce your husband to the level of a sex toy and to raise your husband to the to the sex toy to the aspect of your husband. We call that either minimization or magnification. Once you go through that, it's a cognitive bias. So what we want to say is that your husband is your husband. Have him as your husband. Respect him as your husband. Don't reduce your wife to a sex toy. Manage him as a human. Explore him, and then make him your adorable husband and wife. And in any little way, I'm sure sex will be great. Even if it is minimal, you will enjoy it. It's all about your brain, your mindset, your emotions, and how you respond to the sexual advances and experiences. It's good to go.
Okay, thank you so much. We have this question, Doc, it will come to you. I know you might have mentioned it earlier, but probably the viewer joined late. The viewer is asking, what are some common causes of erectile dysfunction in men? What are some common causes of erectile dysfunction in men, and what steps can be taken to address or manage it?
All right, so common causes of erectile dysfunction in men. We'll look at vasculogenic causes such as hypertension, coronary artery disease, peripheral vascular disease. We'll look at endocrine causes such as diabetes mellitus. We'll also look at thyroid disorders, hyperprolactinemia. We'll look at hyperlipidemias as well. We'll look at neurogenic causes such as peripheral neuropathies, spinal cord injuries, strokes can all cause sexual dysfunction. Medications such as antihypertensives, for instance, beta blockers, methyl dopa could also cause erectile dysfunction. Then the use of substances could also cause, and alcohol could also cause erectile dysfunction. How can this be addressed? Some general principles, lifestyle modification. So you want to improve your exercise, you want to lose your weight so your BMI is within the normal range, you want to improve your diet, those are avoid substance abuse, minimize alcohol, so those are general principles, and then the specific cause will then determine the solution. Then also there are some, as I mentioned, some medications that can be given for erectile dysfunction. Phosphodiesterase 5 inhibitors, for instance, can be used. You could use implants for erectile dysfunction. We could use intracavernosal injections for erectile dysfunction. So there are so many remedies for erectile dysfunction, depending on the severity and then the cause.
Okay, I mean, our phone is buzzing with a lot of questions now.
So but I wanted to add on a little to Doc's submission. Just to add on is that masturbation, some of the youth are indulging themselves too much into it. I had a client who could do as many as 27 times in a day. So he's become something else. So masturbation, watching the pornographic stuff, you see, porn, and those things and then buying medications. People want power, manpower, something to make your penis big, and to stand erection for a whole day and what have you. We want to advise the youth that seek help from appropriate quarters like Rafa. Don't go around buying anything, taking anything for manpower, black power. It could be deadly.
Okay, thank you so much for this. But Doc, I just want to ask you, manpower, something to make it big. Is there anything like that to make it big? Or it's just delusional?
Interesting. So something to make it big. In this technological age where there is so much advancement in science, where we have a lot of organ enhancements, you want to seek appropriate care. You want to seek appropriate care if you want to enhance an organ and not go over the counter or into the public space and just buy anything to use.
Okay, we have a lot of messages, so let me just take them and then we'll try and wrap up. This person says, please, myself and my wife recently got married and are all first timers, hence we find it difficult to penetrate. Initially, I didn't know the way, but after discovering it, my wife often complained of pain. Please, we need your help, for we haven't enjoyed sex yet in our marital home.
Oh God.
And that's from social media.
Yeah, it's
Okay, so this, in fact, I had a couple some time back, and they had a similar challenge. So they were both new to the act, got married, and a week after marriage, then the husband called that we are unable to have sex. What should we do? So then I asked, did you have premarital counseling? He said yes. So what were you taught about sex during the premarital counseling? And the man said, oh, they were told that once they get to the bedroom, they'll be able to find their way. So I think that premarital counseling should have some component that is dedicated to sex and sex education.
Yeah.
Now, especially because the man must understand the female anatomy.
Sure.
Okay.
Even the woman must understand her own anatomy. There was an instance where the man was trying to penetrate the lady via the urethral meatus, where the urine comes from.
Okay.
Instead of the vaginal orifice. So if you don't understand the female anatomy, you would want to penetrate where you shouldn't. So for this particular couple, for the woman, for them to have a very good sex, there must be good lubrication. So the excitement stage, that foreplay stage, must be a bit well done. They must know the various erogenous zones, as my sister Charity mentioned earlier. The 8 erogenous zones, and must be able to use them properly. So the mouth, the neck, the nipples, the areola, the ears, the clitoris, the vagina, they must be able to use the erogenous zones correctly. Once they're able to do that, that will stimulate the woman properly and prepare the woman for insertional or penetrative sex. So those are some of the things that they can do to improve their sexual experience.
Okay, doc. I think we would have to do a part 2 of this some other time, because you're talking about all this. I'm tempted to ask whether sex before marriage could be a solution, but we'll leave that for another topic. Let me just read this one also from social media. The person, is it true that men need to have sex 21 times in a month so as to avoid prostate cancer? I think that's what the person is trying to ask, that if it is true that men need to have sex 21 times in a month, how many days do we have in a month so as to avoid prostate cancer? Doc, you can take that.
All right, so there are a lot of myths and misconceptions all over the place.
Sure.
So there's no literature that says that once you have sex 21 times a month, you would avoid prostate cancer.
Okay, and then this one, is it true that much sex can help reduce or prevent developing prostate? I think it's the same thing you've answered. One is asking, how can couples build emotional intimacy? What kind of exercises can couples do to enhance this? I know we've mentioned
emotional intimacy.
Already mentioned this. This person is asking, how can women who are struggling with expressing their feelings about sex have good sex? How can we ensure that men listen to women during sex? I think, let me take that again so you can say something briefly on that. The person is asking, how can women who are struggling with expressing their feelings about sex have good sex? How can we ensure that men listen to women during sex?
Okay, so we want to encourage all women that, please, that time that we will not talk about sex is past. Just encourage yourself and know that it's a need in your relationship. You need sex to be part of your relationship. So talk about it in little small steps. Don't start boom. Your husband will be shocked at you. But just start little by little. Talk about it. Build it on emotional language. It could even be touches. It could be approaches to the love handles. In all ways, you could talk about the sex. It's not straight talking about the organs, but anything to do with sexuality. Just start in little bits. Push yourself up. Encourage yourself. Men, we know that men are mostly a little bit poor at listening, because men usually, they like moving and doing things that are bulky. But please, have ears for your wife.
Okay.
Listen to your wife's emotions and, you know, get connected to your wife and help your wife through whatever she's going through. Give her all the needed attention. And when she's talking, wait, listen, stop, paraphrase, and be connected to your wife. We are pleading with men to give room to the women. But sister, if your husband is not minding you, go and stand in front of the mirror, talk to yourself, put some videos in your ears, listen to music, and happy yourself. It's not always your husband. It should come from yourself.
Great.
Thank you.
Doc, let me ask you the same question. The person is asking, how can women who are struggling with expressing their feelings about sex have good sex? How can we ensure that men listen to women during sex? That's
All
the
right,
question.
Kofi, thank you very much. But just to make a quick comment before we come to this substantive question. The question on whether when you have sex 21 times in a month,
Yeah.
you prevent
Prostate cancer.
Yeah, so 21 times in a month, no. There is no concrete literature that says when you have 21 times in a month.
But is there any particular
But
number?
then, there is some evidence, not fully concrete, but some evidence that if you have frequent ejaculations, there is that potential reduced risk of prostate cancer.
Doc, take
So-
that line again.
So-
I think my men will like that, so please take it again.
So there is some evidence.
Some evidence.
Further research is still ongoing that when you have frequent ejaculations,
Frequent ejaculations.
there's that likelihood that you have reduced risk of prostate cancer.
Okay.
But not 21 times in a month. That's what I want to clarify.
Okay. Okay. And there was this question, though we answered, but this person has put it in context. How can couples build emotional intimacy? What kind of exercises can couples do to enhance this? The person is asking, if your partner is abusive, how then do you build emotional
Yeah,
intimacy?
it's difficult.
Yes.
Yeah, if your husband is abusive, then it's quite difficult. As Doc mentioned, let's see the roots to the problem. So this intimacy issue, emotional intimacy, is because there is an abuse. So the abuse must be corrected. But what do? Address the abuse. Talk to your husband, conflict resolution, empathic listening. Put yourself into your husband's shoes or your wife's shoes. Listen to her compassionately. Paraphrase whatever she's saying. Let's put in efforts to solve the problem. I mean, certain things must be done right to help ameliorate the pain the woman is going through. When we do things right, the emotions and the pains will just dissolve, and then you have a great sex.
Okay. So let me ask my last batch of questions. This person is asking, is sex addiction possible? How can people address sex addiction? And how can sex addiction be treated? Is it possible?
Yeah.
How can people address it? And how can it be treated?
Yeah, it's a behavior, and most behaviors.
Is it possible?
Yes, people are addicted to sex. Someone will ask me, Didi answer na maye, and I mean, answer na maye, answer that thing. So it means that sex has been minimized to food. So every day we eat 3 times. So it means you must be ready. There are some people who are addicted. It depends on where the person is coming from, the experiences of the person, and what is bringing about this addiction. Addiction, always we have to do. It's a behavior from the mindset to the emotions. Things are not balanced. Once it's become an addictive, then it is not pleasant. It's not lovely. You are punishing your partner who has to go through these things every day with you. You need help. So quickly seek for psychological help to help you correct these defects. It can't be.
Okay, Doc, can it be treated? Sex addiction.
So, just as any addiction can be treated, sex addiction can also be treated. And I will gladly refer you to the clinical psychologist
Okay.
to help you manage any addiction, including sex addiction.
Okay. Doc, someone is asking, you spoke about lubricant. Someone is asking if, I don't know if you'd want to answer that. Someone is asking if you would recommend a particular brand, any lubricant.
Alright, so typically I will not recommend a particular brand but you can get water-based lubricants. That should help. If you think that the issue you're having has to do with lubrication, but I will not recommend any particular brand.
Okay, someone is asking if there are any do's and don'ts for couples in having good sex. Any do's and don'ts for couples in having good
I
sex?
think we've spoken a lot about what people should do in having good sex. Open communication is very important. During the excitement phase, you want to have very good foreplay. That will also go a long way to improve the sex experience. Then lifestyle-wise, you want to be a healthy individual to enjoy sex. So your exercise, your dieting should be good. You should avoid substance abuse. You should also minimize alcohol intake as much as possible. Always get checked. Get onto one of the wellness packages for men or women and get checked. And you should be able to enjoy your sex life.
Okay, Doc, someone is asking if we can throw more light on creating or having sexual habitation, as you mentioned. Someone wants a bit more light thrown on that, creating or having sexual habitation.
Okay, so creating a sexual habitation has to do with yourself. You know, the couple must come together to know what sex is all about, where they have to meet or agree on where they have to involve in the sex, and then also making it as pleasant as ever, making sure that STIs and other infections are checked so that you can't doubt your husband or your wife. Faithfulness must play a part, reducing stresses, and then also making sure that you are not having side chicks. You are faithful to your wife and your husband, and then making the sex a personal choice that the two of you have agreed that this is what we are going to do and feel comfortable in doing it. And even if you have to go for family planning so that you don't have sex in fear of getting pregnant, and making the sex very pleasant and good, and not making the sex as an activity that everybody should watch. It should be private in your room, so children will not be seeing you, making it so open. And then also putting in things in place to make it pleasant. So when we put all these things in place and we try and spice up our sex and make it habitable, I think we'll enjoy it and it will be great fun for us.
Okay, so this is my last but two questions. Someone is asking if there can be rape in marriage, and then also what do you do if the sex is continually bad? Continuously, if the sex is bad, what do you do, and whether there can be rape in marriage?
So if the sex is continually bad, I would advise you seek care. Seek help medically and seek help from a clinical psychologist. The sex is continually bad, please seek help.
Okay.
Of course, rape can happen anytime, whether you're married or outside marriage, there can be rape.
Okay,
Yeah.
and someone is actually asking how you can escape from an abusive partner who wants sex.
Yeah, abusive partner who wants sex, escaping from that person to where are you running to?
I mean, if your husband is trying to be abusive and rape you.
Yes, you can't run away. At that particular time, maybe you have to exercise patience and let him have it peacefully with you instead of the rape. But after that, solve the problem. Don't just sit down and keep going through these molestations. You end up dying. So we are pleading, seek for help. Come see the psychologist, the counselor, and try to talk to your husband to also seek help. It's not you alone. He also needs help because the problem is coming from him. When they meet him, they can help him. Maybe it's outside him. They can help him come out. But saying that you are running away means that you face the problem one day. Let's solve it.
Okay.
Yeah.
Okay. Our very last question. You know, the questions keeps coming, but we need to wrap up. Our very last question. One is asking how do couples maneuver conflict around sex.
Okay, conflict around sex is part of conflict resolution.
Sure.
When the activity is about to come on, that's not the time to talk about the conflict resolution. You see, the man is on heat and you are not saying that Tinasenayan cancer. It won't help. So please enjoy your sex, and after that, sit down amicably at dawn, in the morning, in a chat, in the car, you are cooking, your husband comes around. See some space, the time you see him happy, and you talk about the issue. Try and solve your marital issues outside the bedroom. But we want to speak to the women. Sometimes we carry unnecessary things to the bedroom. If the issue happened in the kitchen, settle it in the kitchen. In the hall, settle it in the hall. Why do you carry the whole clutter of the day to the bedroom? You can't solve those problems in the bedroom. Seek the appropriate quarters, see the appropriate vulnerabilities, and then speak to the issue. Solve all conflicts. Do your best to minimize the conflicts, and then go to the bedroom with a free mind. But even if the problem is not solved, don't carry issues to the bedroom. Do your best to solve the problem at the appropriate place and quarters.
Great. So we are about wrapping up. Doc, that's your camera. What are your last words?
All right. So I would say that sexual dysfunctions are common. They are treatable. And so I will encourage all couples to pass through if they have issues with sex and sexual dysfunctions, and we will be glad to assist in solving their issues. I will also, at this point, want to say that we want to introduce to women in the reproductive age what we call the Talk to Your Midwife program, which will be starting on the 8th of March.
Talk to Your Midwife program.
Yes.
By Rafa Medical Center.
By Rafa Medical Center.
Starting
on the 8th of March.
8th March.
Where very charismatic midwives will be available online to interact with our women and also men, couples, about conception, pregnancy, and pregnancy-related issues. And we are sure that this will go a long way in helping our women and our couples solve some of their pregnancy-related issues and conception issues. So my last words, sex and sexual dysfunctions can be treated. Seek help.
Thank you. Madam Charity Kuwornu, your last words, please.
Thank you. I think it's an honor on this panel. It's been nice talking to Dr. Kwashie, and we want to appreciate Rafael Medical Center for promoting this big platform. I've said that sexual communication is key. So open up. Sex is a consensus between a partner and a wife. So if it is so, why do you have to have secrets in your relationship? Honesty, kindness, openness, love, faithfulness, chastity are all vital parts of sex communication. Let's try and speak to issues, let's diverge to diverge, and then in the end, let's come together with a consensus, build better homes so that we can bring up children that will also manage their lives well. Then in the end, the whole globe and Ghana will be beautiful because our sexual relationships are regulated and coming up in the best way. We wish you well in this Valentine's season and hope you enjoy great sex with your wife, with your husband. God bless you.
Doc, I did mention that we are not taking any more questions, but I mean, for them joining us tonight, I just want to ask the very last question. One person is asking what you would do if your partner does not give you sex often, and if you complain that your partner says you love sex too much, what would you do?
That's an interesting one. So I think that it all boils down to open communication between the couple, so that you are able to discuss freely and frankly what you expect of your partner and what your partner also expects from you. And also I think that if the sex itself is enjoyable enough to the other partner, the person may increase the the person's availability for the sex may be
The
better.
rate.
But if the sex itself is not pleasurable and is painful, then the person may avoid sex. So this it's one of the sexual dysfunctions, sexual aversion disorder, where people avoid it because of pain
Okay.
or because they are not enjoying it. So again, I would say that this couple can seek help and see how best to help them. On this note, I also want to wish everybody a happy Valentine's Day. We should celebrate Valentine's Day quickly. At least get your partner a bag of chocolates. That will go a long way.
Okay. Thank you all for joining us. I've actually had a great time. I have a lot of takeaways, and I know you definitely have a lot of takeaways too, especially with the kitchen kunchan things. I know my have taken. Happy Vows Day in advance to everyone. Go out there, show love, show love, show love. And all that you've learned today, please don't let it be in vain. Put it into practice. And if you need medical help, if you need psychological help, Raphael Medical Center is always here for you. My name is Kofi Annan. I was your host, and I was joined in CDO by clinical psychologist Madam Charity Kuwornu and medical director for Raphael Medical Center in the person of Dr. Michael Kwashie. I personally promise you a part 2 of this segment because I know you will love it. Stay tuned into Raphael Medical Center. Thank you for joining us. Enjoy the rest of your day.